Welcome to another episode of the Excelerant Advisor. I'm your host, Tom Hickey, and today we're diving into a topic that's more relevant than ever, especially considering the changes we've seen in the healthcare industry over the past year. I mean, like it or not, the business of healthcare has transformed radically. And if you're not adapting to meet these new demands, you might find yourself being left behind. So, today, as mentioned in the introduction, we have a terrific guest. Mr. Frank Ripullo, Managing Partner at Excelerant Consulting. Hey, Frank, are you ready to be our advisor today?
Indeed, Tom. Absolutely.
It, it's great to have you. And Frank, you've got a great background. You're a highly accomplished senior executive, C-suite officer, consultant, and entrepreneur with more than 20 years of experience in healthcare, medical devices, and cybersecurity. One of your greatest strengths I've read is, envisioning the big picture as well as being skilled in business analysis, strategic planning, new product commercialization, and corporate accounts. So, what's kind of your sweet spot? Is there a particular size of company you like to work with?
I gravitate towards startups, and I think that's because of the intrigue of what they're trying to solve in healthcare. But my focus is really small to mid cap companies. Um, that's where we really can accelerate their business, enhance their initiatives on top line sales, and create valuation working with aggregation groups. So I would have to say that's my sweet spot.
Yeah, yeah, gotcha. So, as mentioned, when we started off here, there's been significant changes taking place in healthcare over the last year. Can you give our listeners just a brief overview of what's been happening?
Well, lots happened. A lot has happened on both the supplier side as well as the provider side. So when we look at um, the industry as a whole, we've seen this change when it comes to making decisions, and it's become very multifaceted. So I don't have things in a particular order, but we are really seeing a limited face-to-face access for sales reps, which turns the whole process into being very transactional versus building relationships. Um, Hospitals are tasked with trying to digitalize their purchasing platforms. We're seeing major shifts towards that process, along with how the organization is going to make decisions as an aggregate versus champions that will carry a product through. Um, so with these greater changes, we have to be very efficient in our communication, and we have to have a dialed-in value proposition. That indeed is very paramount to how suppliers can start to work with providers and understand what their workflow is and how they can be part of um, that workflow process within that annual year to make sure they're relevant. And what I mean specifically by that, for every provider, they do follow a workflow process. So if they're working on 80 initiatives and you want to be in that top 80, you have to have a compelling reason why they're going to insert you there and then see if they can bump you up into the top 20, and have an opportunity to get trials going, evaluations, possibly generate a PO because you're solving some critical areas for them.
Yeah, got it. So, to get in that top 20, are there like some specific changes, that you could point to? I mean, there's a lot that's gone on. There's been a lot of evolution here. Are there really some specific, implications, especially for companies in the med device industry that you can dial in on here?
Well, Tom, you got to look at the verticals, right? Um, you have physician preference items, med surge, capital, purchase services, which is your non clinical spend. Um, you still have your distribution. So when you start to look at these categories and come up with the subcategories, health systems are looking for what's going to be the most impactful in terms of ROI, along with where they're going to shift their resources. So I'll pick on med surge. And if you're coming in as an outsider and you're going to offer 5 to 10% savings. For most health systems, they're better off just to go back to their incumbent supplier and see if they can match that. Because to put the focus on doing a full conversion, whether it's fluid waste, DVT products for pulmonary emboli, um, anything surgical, it's not worth their time and effort. But if you're targeting areas, say like orthopedics, cardiology, you're getting into spine, and you have ways to have not only better outcomes for the patient with a strong value proposition, but you're also able to take cost out, that becomes very enticing to the provider to say, this is where our focus is going to be. So getting that top 20 list can coincide with an RFI, RFP process because it is front and center. But unless it's a comprehensive solution that brings not only multifaceted um, solutions, but it's also going to fall into a multifaceted decision making process on the provider side. You know, the days of um, working the ground floor and then taking that to the IDN, thinking they're going to drive standardization is, you know, from what I'm seeing, is gone. Um, because you can have biomed to the CFO, the CEO, a nurse manager, the account manager, all the people sitting in a room making a decision in a product category, if that's where they want to be. So I don't know if that answers your question, Tom, but
Yeah, it does, but let me expand it. I mean, it sounds like a really complex and challenging environment, especially for medical device companies. So, with all these pressures in mind, how do these companies really position themselves now for success in this new landscape? Do you have any thoughts for us there?
absolutely, Tom. I have a lot of thoughts, and I'll try to keep it somewhat condensed here. For example, if you're in the physician preference area, and whether it's biologics, hardware, or anything where you need to get the attention of supply chain, I would highly encourage any supplier to make sure that those physicians are putting that supplier product and clinical data into their MPRs, into their portals. So that way, when there's a touch point with the supply chain at the IDN, they see that there's interest. That is still front and center. I see it in mesh. I see it in biologics, bone void filler. That's how you're going to move it. So you have to have that approach where you have a national accounts initiative going after that IDN. And if that coincides with the GPO that maybe you have a contract with, or even an IDN where you don't have the GPO contract, but you're bringing tremendous value, you still need that physician to making those requests. When you get more into med surge, capital, distribution, that's a little bit of a different playbook. And that does fall more into where the supply chain is putting their time and resources. And if you want to really be relevant to some of their initiatives, you you got to more than ever have a strong clinical outcome, what we call prospective outcome data that really demonstrates real outcomes. And I think if you can do that as a supplier, it's not that the IDN is going to say yes to you. What they're going to do is it's going to go on their desk, and they can't ignore you. So obviously they're looking to push suppliers away that are just eating up their time, and rightfully so, right? Um, they got their challenges, and so they can't entertain every supplier out there. So that's why they turn to their GPO. There's a trust factor there, and then there's resources you can leverage if you're on that GPO, such as like using picking on Premier. They have regional directors that can provide some intel that allows you to do cross referencing and start to show whether it's savings, better outcome, combination of both. Those are things that will resonate during your sales process and journey in cultivating top line sales. Absolutely.
Yeah, so let me ask you. I mean, you talked about data and outcomes, and it makes me think of studies. And so, how do you present all this? Is you just take all these studies and put them on their desk, or is there a way that we can distill all of this so it's easy and concise and understandable for individuals across the spectrum? I mean, you've got supply chain people in there, you've got clinicians in there, you've got a lot of stakeholders. Is there a way of making this really concise that even a layperson would be able to understand the value?
They're going to understand it directly if you're highlighting where that clinical data, especially the prospective clinical data, really demonstrated what that patient population looked like and what that true outcome was. So I always suggest, instead of bringing a stack of studies and overwhelming everybody and dump it on their desk and then saying that you've covered every angle in this procedure, you're better off to highlight one or two impactful studies, have a one sheeter where it's a synopsis of that study, and leave it to the discretion of the clinician if they want to read through all the details of the study. But I think if you want to get their attention, it's the synopsis along with working with clinical education. There are portals in which documentation can be uploaded and be accessed through the hospital portals. So there's definitely things you can do, but um, if you're a small supplier and you don't have the luxury of going out there and spending $500,000 on a prospective outcome study, then work directly with the health system that's local to you, that might be of a magnet status, could be a level one trauma center, could be a university that can show that during a conversion that they've done their due diligence and this is where their outcomes came from.
Yeah, gotcha. So with a lot of these companies, that can be a challenge, especially if you're an innovator, you're more of a startup, or maybe even that same wheelhouse you spoke about. Is this something that Accelerant Consulting could help a company with as well in terms of getting that concise value statement?
Well, for a lot of early stage startups, early stage, and even mid-sized companies, um, they really need to sit back and say, what's their value proposition? I mean, the three things that every supplier is going to tell you is they're going to give you better outcomes, they're going to give you um, uh, significant cost savings, and they're going to give you a better patient satisfaction. That's that's pretty generic. Um, but if you're going to say that, where's the substance behind that? Have have some so-called meat on the bone if you're going to walk through why you're making these claims. Don't make this macro claim that you're going to do all these things because that's what they hear all day from suppliers. So now you got to take them down this journey of saying, with our value proposition, here's touch points that fall into procedure and protocols that really resonate with maybe discharge planning, with never event categories, um, how they're making sure they're not getting readmissions. So if you can tie into that with a good value proposition that has really good supportive numbers, you're going to get an opportunity. It just cut the fluff out is really what it comes down to. And don't give me this high level that we're going to fix all your problems. And we're seeing this a lot in telehealth where they they come in with 50 different things they can solve, and really what they should be focusing on is one, whether that's an whether it's in orchestration of how patients come in through the and then move through the operating room. It could be based on efficiencies. How do you alert EVS? I mean, it's just so many variables that come into play. But when you're trying to solve too much, I mean, Tom, honestly, I wear running shoes to run, right? I wear dress shoes to put my suit on. I mean, I don't even have shoes that do all the things that these new technologies, IoT, whatever you want to call them, are trying to solve. And you can imagine on the provider side, it's very overwhelming because it's too good to be true, is what it boils down to.
Yeah, yeah, gotcha. So, Frank, that's really been valuable insight for our listeners, and we really appreciate your shedding light on some of these changes and challenges in the healthcare industry, and providing some guidance for us. If somebody wants to find out more about you or the team at Accelerant Consulting, how do they find out more?
Well, look up my name on LinkedIn. That's an easy way to find me. Go to our website, accelerantconsulting.com. We're on all the social media platforms. And my email address is real simple. It's my first initial of my first name, F, and then my last name, Ripullo. So it's F Ripullo at accelerantconsulting.com. And I'd be more than glad to chat with you and have a conversation and see if there's, you know, some takeaways or deliverables or scope of work we can put together that helps your company grow.
That's fantastic. So, Frank, we really appreciate your time and insight today, and appreciate your being our advisor.
Thank you, Tom. Thank you for having me.